Welcome back to Listens Live. We have Dr. Doug Kane joining us now from Cornerstone Wellness Center, going to talk a bit today about the process, what it's like if folks are calling you. And I know neuropathy obviously was the big topic we hit on last time, so we'll touch on more of that today too as we head into the warmer months here.
Yeah. So, yeah, neuropathy is probably the most common neurological disorder diagnosed today. The prime driver is diabetic neuropathy, which, of course, we're in a diabetes crisis here in the last 20 years in our nation.
Especially our region.
For sure. The second most common cause, we see a lot of chemotherapy-induced neuropathy. That was actually my mother's case. You know, she was here with us last week, and she's done extremely well. We have people that, you know, have orthopedic injuries to spinal regions, or they've had surgeries with, hip replacement, knee replacements, foot injuries that have affected these nerves. So they don't transmit information properly, and these people get a lot of abnormal sensation. The biggest thing being just excruciating pain or numbness. Numbness to the point that they can't feel the gas pedal, so they can't drive their car. Really interrupts quality of life, daily activities, ability to sleep, ability to be with loved ones. Because if you just hurt all the time, you just want to be in a chair with your feet up.
And Dr. Kane, we talked about this a little last time. As people go into summer, they change what footwear they're wearing. The activities become a lot more mobile-based. And so maybe you've been cooped up all winter long already, and now you don't want to have something like neuropathy keeping you inside during the most beautiful time of the year as well.
Yeah, well, for sure. Getting out and doing things, family picnics, traveling, vacation. But really, it's even just the simple little things, is being able to get down on the floor and play with your grandchildren. And, if you don't feel good, eventually it's kind of that law of unintended consequences. People don't want to be around you. You're not the fun grandparent, and the next thing you know, you're not seeing your grandkids as often. It's not anything that's on purpose. It just happens as a consequence of the amount of pain that you're dealing with. And so, fortunately, now we have the ability to halt that and reverse that, and in many cases, get rid of it completely.
When you were here with us a couple weeks back, you mentioned that you brought your mom here, and she told us here on the set that having the treatments, getting what you were able to provide was life-changing for her. Can you talk to the folks who are at home about how this is the work that you do? Clearly, it's personal if you're able to help out somebody as near and dear to your heart as your own mother.
Right. Well, I mean, for her, her feet were just on fire, constantly burning. She also couldn't stand anything touching, and we hear this a lot from our patients. So can't get a good night's sleep. So she would have to literally pull the covers up to where they weren't touching her feet, so they would stick out, because if they did, it was so hypersensitive, it would be painful, it would wake her up. So these are the kind of changes that we're able to make with people, so they can, if your body doesn't sleep well, if your brain doesn't rest, your body's just not going to function at its optimum. It's that simple.
And it sounds like for some folks it is impossible to get that rest with something as slight as the brush of a covers could yes. cause that reaction. Okay, let's go into some of the process, because I know we've got folks sitting at home watching or have seen you before and are saying, I really need to get this taken care of. Walk us through if we come into the office, I'm a new patient, what can I expect?
Okay. Well, the first thing you need to do is just call the number on your screen. You'll talk to one of our wonderful staff members that will get you scheduled. The first thing we're going to start off with is a very thorough examination. Okay, it'll be unlike any examination that you've ever had before. It doesn't hurt. We don't break the skin. There's no needles. There's no expensive scans or anything like that. We keep it very simple. There's 7 different types of sensory nerves that are involved in neuropathy. We test each of the 7, and we determine how well they're working. We rate it from 0 to 10. That gives us a composite score. That way we know how much sensory input that you've lost, and that's our baseline. And then as we begin our treatment, we reevaluate every 90 days, and we see those numbers come down more and more each time. One of our instructors likens it to if you're at a very loud concert, if you have your head close to a loudspeaker, if you turn it down just a little bit, it can make a big change.
Right.
And that's what we see with our neuropathy patients. Sometimes even a 5% improvement, which is very small, is life-changing for these people.
Obviously, everybody that's suffering from some type of neuropathy, there's different reasons why, there's different levels to it, so the treatments are going to vary. But can you walk us through, if there is a general way, what a treatment would look like for a typical patient?
Sure. The most important thing is these treatments are designed to be done on your own in the home, okay? We're dealing with a group of people that already have mobility issues, already don't feel good, they don't want to get out. So that's by design. There's generally a couple of pieces of FDA-cleared equipment that they're going to use home on a daily basis. It's going to take as much as 2 hours throughout the course of the day, broken into half-hour segments. Again, with the mobility issues, these people are generally sitting, so that time is not usually an issue. But you continue to do this over time, and we we maintain your progress. We chart that along the way, and we make changes as necessary. For a lot of people, there's going to be some dietary changes. Our standard American diet is very inflammatory, and so at the heart of it, part of neuropathy is an inflammatory process, so we're going to dial that back, especially with diabetic folks. So we get to the point where those nerves can heal. So at the end of the day, it evolves around blood circulation to those nerves. If those nerves aren't getting oxygen and nutrient, I mean, how well would you function if you were starving and suffocating? Okay, that's exactly what happens with the nerves, and that's at the heart of us changing this. So, great graphic up right now. So, if you look at the one on the right, you see we've heard phrases like red hot or white hot.
Right.
When we look at an infrared camera at someone's legs or feet, that's exactly what we want to see. That's normal on the right. On the left-hand side, we see when you get down to the foot and the toes, we're starting to see yellows and greens and blues.
Totally different.
That tells us that there's not a lot of cellular circulation, not a lot of heat reflected. The great news is this is the same patient 90 days apart. This is the before and the after.
Come to you today, the end of summer, we may be seeing a whole new person.
Absolutely.
We've got less than a minute left. Let's just touch a bit on the financial side. Again, I know it differs based on what you're going to need, but if folks are wondering back at home.
Sure. Great question. We have financing available. As my mother would explain, I'm single and retired and on a fixed income. That's almost everybody in the demographic crowd that deals with neuropathy. So, and every treatment is individualized, so there's no one size fits all. But we can finance that generally from as little as $150 to $200 a month to help you get your life back.
It's good to know. Dr. Doug Kane, thank you again for being with us, helping change folks' lives at Cornerstone Wellness Center. If you're suffering from neuropathy, you know who to call. Thanks for being with us today on Listens Live. See you back here tomorrow.